Welcome to another lesson by BeWell. Shaping the health and care workforce of tomorrow. The BeWell project addresses the need to prepare the health and care workforce for green and digital solutions introduced in the European health and care systems to ensure they can respond to current and future challenges. Welcome. In this lesson, we will discuss another type of telehealth, teleconsultation. We will see how telehealth facilitates communication between healthcare professionals when they need to consult about a patient. I wish you a great lesson. Let's get started. At the beginning of this lesson, we will listen to the experience of a colleague from the hospital in Telehealth, Bergamo, Italy.
I'm an head and neck specialist, and I'm here to introduce you to this new multidisciplinary approach to oncological patients through telemedicine. We started using telemedicine for our oncological patients about 4 months ago, and the results are excellent, both in terms of patient satisfaction, and in terms of improving the performance of waiting times and getting better for the comparison between medical colleagues.
Now let's continue by trying to define teleconsultation in more detail. What is a medical teleconsultation? According to some European state regulations, the teleconsultation is a medical act in which a physician interacts remotely via a video call with one or more doctors to dialogue about the clinical situation of a patient. Based primarily on the sharing of clinical data, reports, images, audio videos concerning the specific case. All the elements are shared electronically in the form of digital files on the telemedicine platform. The medical teleconsultation contributes to the definition of the report, which is drawn up at the end of the visit provided to the patient, but does not give rise to a separate report, but rather to a collaborative report, which takes into account the observations made by all the health professionals during the discussion of the clinical case. And now listen to the experience of the colleague.
We use telemedicine software for teleconsultation applied to our cancer patient. Through the use of this platform, we can connect online with our colleague, radiologists, oncologists, speech therapists, radiologists, and all the specialists who serve to manage our cancer patient. The use of telemedicine allows us to be more efficient, even in the event of the physical absence of our colleague. We can connect from each hospital and in real time, therefore issuing a report that we can deliver to the patient. This greatly streamlines waiting times and improves the performance of the service provided to the patient. This is a very smart and easy approach to a topic, and sometimes difficult to manage between various specialists. I can load any kind of document like histological report, radiological image, and discuss with them to decide the course of treatment. At the end of the meeting, we can issue a report that we can deliver to the patient.
And now let's go with some tips on regulation. The medical teleconsultation is among one of the minimum telemedicine processes prevented be delivered in the healthcare facilities. The regulations about the medical teleconsultations are not new. Every country has its own history regarding this. If we take a look at what happened, for example, in Italy, we note that, even before the COVID-19 pandemic, in 2014, the Ministry of Health issued the first guidelines. However, the pandemic gave an impulse to the development and to the implementation of telemedicine in the care pathways. Starting from the 2020, more and more detailed guidelines have been issued about the matter. As an example, in the figure, the most relevant reference Italian regulations are presented. The most schematic and simplest way to describe how a medical teleconsultation takes place is the process flowchart. Each lane represents an actor involved in the process, while rectangles represent the different activities to carry out. Here, we present you a generic case in which a physician needs to consult another physician for discussing the clinical situation of a patient. First, the requesting physician calls the dedicated office to ask for a medical teleconsultation with a specific physician. The office clerk looks at the availabilities given by the physician for this service, and the appointment is agreed. The office clerk arranges the appointment on the telemedicine platform, and the physicians receive an email with date and hour of the medical teleconsultation. Days before the appointment, the requesting physician has the possibility to upload on the telemedicine platform any clinical documentation that could be useful for the discussion of the case, so that the consulted doctor can have a look in advance and be prepared. The day of the appointment, both doctors log into the telemedicine platform, discuss the case and define the outcome of the teleconsultation. If the patient must be reevaluated, the two physicians in accordance define the diagnostic therapeutic pathway. In any case, the consulted physician, at the end of the teleconsultation, must draw up the collaborative report where she writes what discussed during the teleconsultation and the diagnostic therapeutic proposal for the patient. The collaborative report is signed and the consulted physician uploads it on the telemedicine platform so that the requesting physician can download and file it. The process described up to now is a general case, which examines a situation where a doctor requests the advice of another doctor through a teleconsultation by virtue of her specific competence. Now we are going to illustrate two examples of real application of this process in an Italian healthcare facility. The first application case refers to the multidisciplinary teleconsultation in which physicians with different specializations meet up on a weekly basis to discuss complex clinical cases, oncologic patients. The use of teleconsultation allows optimizing patients' care since all the specialists involved in the care pathway are present and they discuss among each other. The organization of weekly appointment allows optimizing time and resources by increasing the speed of patients' diagnosis. Now therefore, the quality of the service delivered improves. The second application case refers to a virtuous example of integration between primary and secondary medicine. In this case, teleconsultations take place between general practitioners who work at the territorial level and physicians who work in hospitals. In particular, the GPS have the possibility to ask for a specialized opinion about the clinical situation of their patients by requesting a teleconsultation with hospital specialists like geriatricians, cardiologists, neurologists, and so on. The main objectives of this service are the facilitation of the communication between primary and secondary medicine, the integration of skills between GPS and specialists, and the increase of the appropriateness of GPs' prescriptions.
In this lesson, we learnt what a medical teleconsultation is, how it takes place and in which fields and with which objectives it can be implemented inside the healthcare facilities. We have listened to colleagues who are already using this technology effectively. Thank you. Let's see again.